Hello, I'm Michael Brown, Masters of Science in Healthcare Management, class of 2007, and current chair of the Alumni Weekend Committee and a resident of Arlington, Massachusetts. Welcome to our lightning talks, short talks given by alumni. These are an opportunity to hear stories from one another, and this year we have chosen to invite alumni to share stories about their response to the COVID-19 crisis. Dr. Priya Shankar is a pediatrician and co-founder of Girls Health Champions, also known as Adolescent Health Champions. She has a long-standing passion for gender justice, intersectional feminism, health equity, and adolescent health, which was first sparked during her own childhood and teenage years. Priya is a current Fogarty NIH Fellow in Global Health and a recent graduate of the University of California, San Francisco Pediatric Leadership for the Underserved, otherwise known as PLUS, residency program, where she was a recipient of a UCSF Chancellor's Award for Public Service and a UCSF's Pediatrics Residency Grossman Award for her outstanding qualities as a clinician, as well as her contribution to the community. Dr. Shankar completed her medical and public health training from Boston University School of Medicine and Harvard T.H. Chan School of Public Health, where she co-founded Girls Health Champions. Priya was also a 2009 and 2010 Fulbright-Nehru Scholar to India, where she studied maternal and child health policy. She has worked in the field of maternal and adolescent and child health in the United States and India for over 15 years as an educator and a researcher. Welcome, Priya.
Thank you so much for this opportunity. Hi, everyone. My name is Dr. Priya Shankar. I'm a pediatrician and the co-founder of Girls Health Champions. And I'm really excited to be here today to share a little bit about my work, which actually began while I was a student at the Harvard T.H. Chan School of Public Health. My talk today will be about youth-led health education during the pandemic, and I'll also be sharing a little bit about my organization prior to the pandemic as well. So Girls Health Champions is a nonprofit organization that trains adolescents as peer health educators and health leaders in their schools and in their communities. And it really focuses on gender injustice and gender inequality and the ways that this impacts young women and girls every day with regards to their health outcomes. I became very interested in this particular area, and I realized how present it was in the lives of young women and girls as a youth myself. And specifically, I realized that India's adolescent girls face a 50% chance of being undernourished or anemic, which is 2 to 3 times the rate of their male counterparts, a 40% chance of using unhygienic menstrual protection, a 30% chance of physical or sexual abuse, and a 20% chance of teen pregnancy. So it's no wonder that there's an increased mental health burden amongst these young women and girls. In fact, suicide is now the leading cause of death amongst adolescent females. So I began to wonder if there was a solution right in front of me, and that was the young women and girls themselves. It was about using their own potential and capacity to mobilize and catalyze change. India is comprised of the largest adolescent youth population in the world, with 120 million adolescent girls. If they were to form their own nation, they would form the 12th largest nation in the world. So I began to think, if these young women and girls themselves could deal with the present issues and provide one another with a dialogue, knowledge, support, and prevention strategies to deal with the issues that they were facing every day. And that is how Girls Health Champions began. Girls Health Champions, also known as Adolescent Health Champions, is a nonprofit organization that capitalizes on youth voice and potential by training them as health educators. It's an innovative, evidence-based, sustainable model within low-income schools in Mumbai, India, which really focuses on peer-to-peer education. And it's been a model that's been physician, school administrator, teacher, and research board approved in both India and in the United States. Our model really centralizes youth leaders in the capacity that they can and really focuses on the key areas of adolescent morbidity and mortality, including nutrition and anemia, mental health and substance abuse, puberty and reproductive health, and gender and relationships, as well as now COVID-19. And the goal of this organization is really to instill in these youth a capacity to speak up, to talk about these issues, to fight gender injustice, and to train India's next generation of health leaders. Importantly, many of these issues and many of these topics are rarely discussed within the Indian classroom. And we found that these youth educators, our champions, are so brave in dispelling and dismantling many of these stigmas themselves. We're also known as Adolescent Health Champions because while we began at an all-girls school, we realized that we needed to really work with all of our stakeholders, including our male allies, and have a gender-expansive lens as well. And for that reason, we're also known as Adolescent Health Champions amongst our youth. And this is just a picture of some of our male youth allies who are working to really disband stigma, as well as talk about gender inequality and try to fight that within their own communities. I'm going to share a quick video of one of our youth participants at a high school in Mumbai.
We need to accept that menstruation is a normal part in every female's life. We should celebrate and support the women in our life. As boys, we cannot even imagine how much pain they bear every month, and all the women in our life, our friends, our mother, our sisters, everybody face this every month, and without any excuses, they stand strong in the day-to-day life, and we should support them, we should be proud of them, and we should respect them. Thank you.
So that was an example of a young person who began his teaching and lesson talking about menstrual hygiene and menstrual protection, as well as the physiology of menstruation, and then went on to go off script and talk about the ways it's important for young men and boys to really respect and empower and support the women and girls in their own lives. And so since the time I was a student at HSPH, our organization has been able to train 850 champions who've gone on to effectively educate 5,000 of their classmates across 15 schools in Mumbai. And we've taken a very heavily evidence-based, data-driven approach to our work, looking at the short-term, medium, and long-term impacts of our work, whether it's health knowledge and awareness in the short term, shifting attitudes and cultivating health leaders, and in the long term, also studying health behaviors and practices, which is an ongoing study we're working on now. This is an example of a paper that was just published in July in the Annals of Global Health, which begins to look at the positive shifts in health attitudes, the significant increases in knowledge, as well as how our peer educators really internalize what they learn and how they've had a statistically significant increase in their interest in health promotion. And we've really listened to our communities very closely. This is a teacher at our school talking about the importance of holistic gender education, and especially in a time where gender inequality is very, very present and more common. And our youth perspectives as well, which has gone into qualitative analysis, including students who've talked about becoming more gender sensitive themselves and viewing people of all genders as equals. Another who actually has gone out and set up workshops among students her age to really talk about these issues and spread information in a trickle effect of sorts. So in March of this year, COVID hit, and during this time, India announced a nationwide lockdown. And this was an opportunity for our organization to really go back to the drawing board and listen to our stakeholders very carefully. So we began to have many calls with our children, our teachers, our principals over the course of many months, and we came up with 6 core areas of need. This included worry, anxiety, fear, and loneliness, more calls to the Children's Helpline with regards to mental illness, fear, stigmatization around COVID, and general issues of violence and abuse at home. There's a lack of reliable information around COVID, difficulties with moving to e-learning for many of our teachers in our schools. Many of our youth described losing parents or family members due to COVID, and a loss of livelihood and migration to rural areas as well. And this is an example of a poem that was written by one of our youth during COVID, talking about hoping that one day our world becomes COVID-19 free, as well as some of the pictures and images that were drawn during that time. So through a design thinking workshop with our youth and our team, we decided that we needed to get started and really rethink the way that we were working on our model. We developed a COVID-19 curriculum and also a parents curriculum. We really have prioritized e-resources for our work, including incorporating AHC lessons within the school's online lessons. And very excitingly, we've also co-designed a mobile app, which was inspired by the views and the viewpoints of our young people. This slide really talks about our COVID-19 response, our short-term, medium-term, and long-term goals. While they've shifted a little bit, still really are focusing on our youth voice and listening and engaging with our community stakeholders. So far, we've built our COVID curriculum, our curriculum for parents. We've really focused on building an innovative youth advisory board and council in which we're having our youth involved in every single step of the process of creation of our programming and strategy, as well as our app development and our virtual programming as well. Our Youth Advisory Board is one of our most proudest achievements. It involves 12 students across multiple schools, and these students are some of the most talented, passionate young people, and they've been involved in every step of the design of our organization during COVID and even prior to COVID. We co-designed a COVID-19 curriculum along with our youth, which involves themes covered including signs and symptoms of COVID, the risk factors and dangers of COVID, how to protect oneself and others, and also taking care of one's mental health in order to meet some of the challenges that we described earlier. We also recognize the importance of engaging parents. Youth are now in much closer contact with their parents every single day, and as the primary caregivers and touch points, we felt it very important to engage with these stakeholders as well. So we designed a curriculum for parents that focuses on the core topics in the AHC curriculum, as well as autonomy, independence, and communication with youth. And in light of our focus on centering youth in our programming, these are some of the examples of the innovation and creativity of our youth. These are all designs of an app that our youth created themselves. This was their own idea to create an AHC app to supplement the ongoing virtual education. And as you can see, they're very, very creative and had tons of ideas for how to do it. Today, our app is in the final stages of development. It's undergone many, many iterations till date with the help of our youth. And our hope is that by October, we'll have an app that our youth can actually utilize alongside the pre-existing virtual programming. So looking ahead, we're so excited about the future. It's definitely a different look and feel of our programming with COVID, but we've been very inspired and supported by our youth in really transitioning and creating a new modified programming that's really technology-based. So I wanted to share a video of one of our youth who is a champion and also part of our Youth Advisory Board.
Hello, my name is Neha Bhatt. I'm studying in grade 9 from Vidyadhiraja High School, and I am an adolescent health champion. So last year, when AHC volunteers visited our school and conducted a few sessions, and in one of them, they asked us to talk about mental health and substance abuse. It was a new topic for me. It talked about how adolescents were affected by stress, depression, how social media caused it, and how tobacco, drugs, alcohol affected us. As I was curious about this topic when Dr. Priya and Dr. Ricky explained, the students to whom I presented this topic were curious as well. They asked us questions and asked us to explain certain things in detail. As the pandemic is going on, it affected us, that means the youth, very much. We have been attending online lectures and giving our exams online. We have been away from our friends, from school, and away from any social contacts for almost like half a year. During this time, we have been with AHC, talking about how's our quarantine going. We formed YAB, Youth Advisory Board, where we are planning on conducting more activities. We even designed COVID curriculum in which there are all important informations about precautions, symptoms, responsibilities, and some indoor stress busting activities. We even created our own app. We chose templates, gave some of our own ideas, and voila, soon it will be launched. And all these activities were done virtually. And I think because of virtual meetings, we got to know our fellow champions. Being a part of AHC is so much fun. I learned so many new topics like gender safety, mental health, etc. The great part was teaching our schoolmates about what all we learned. Being a part of AHC made me be more socially active during this pandemic. This program helped me in building up my confidence and speaking in front of new crowd. Since I'm really interested in the field of biology, all these AHC discussions made me want to learn it more. So maybe in future I might take it as my core subject. Thank you.
So that's an example of one of our youth leaders, Neha, who is leading the change and sharing this information with her peers, as well as her family members and community members. So looking ahead in 2020 to 2021, our goal is really to pilot virtual programming as well as our app within our schools. We'll also continue the research that we've been doing for both our virtual programming and our app using mixed methods research for both our program design as well as some of the implementation as well, and continue to build on our qualitative impact with our youth as well using community-based participatory research. And our hope is to really hear from many of you. I hope that you'll reach out to us and get involved with our organization. You can email us, reach out on our website or Twitter or Instagram, because our hope is that in the many years ahead, we'll be able to work together to train India's next generation of health leaders through Girls Health Champions. Thank you so much.
Thank you, Priya. That was wonderful, so meaningful. If you mind, I'd like to ask you a few questions.
Sure.
Culture, this program appears to be breaking down social barriers. Did you encounter any resistance from the communities or possibly the families of these girls as you began to roll out this program?
That's a really, really important question. And I will say initially, especially, that was a big fear for all of our participants and our team. And one of the things that we do that I think should be done for all programs is, one, focus on listening to communities first and understanding how do they feel about these issues, and do they think this is an appropriate solution? That was the first step, was our needs assessment, really talking to our youth and our parents and our teachers. The second thing is that we always receive parental consent, child assent, and school approval for any programming that we do. So there will be a certain percentage of youth and parents who are not comfortable with the program. So I'd say it's probably 10 to 15% of the students. But if you think about a country with 120 million youth, that's just a fraction, and there's so many other youth who you can really engage and work with for sure. So I think the focus on context sensitivity, cultural sensitivity, partnership is a huge part of this. And one of the reasons I showed the video of Neha is because she's honestly the heart of the program, and listening to youth and having them as the focus and the focal point of the organization helps, because then what you're talking about and what you're doing is something that's relevant, meaningful, and appropriate for the schools. The other part of it is that we found through a lot of research that parents and teachers are itching for this education to be taught. And it's often something that adults, even doctors, hold a lot of shame and stigma and taboo around, but our youth sometimes don't have as much of that, and they're more free and able to talk about it in a way that's really dismantling and sort of getting rid of some of that stigma. So that's the other component of it as well. But so far, actually not a lot of resistance, because we really talk to our youth and our teams and our teachers first before we introduce something, even our parents too. We have parent sessions as well, which really integrate the whole community in the process of education.
Great. And the program started out before COVID-19, and obviously went through quite a pivot in terms of changing its focus in terms of the topic discussed and what it managed. So how did the girls feel about that pivot? How did they feel about being in a program that switched so strongly to a new focus?
Well, I would say it's still the exact same focus, because we do all of our programming, but we also added COVID in light of the impact that it's had on youth. One example of how it's pivoted, and just an example of one of our youth describing the impact that it's had. So I was speaking to one of our youth yesterday morning, and she said that, before COVID, there was a lot of excitement. And I remember us working together in schools and us teaching and within the classroom, and there was lots of excitement. And now there's a lot of excitement, even more excitement, but for a totally different reason. So I guess, truthfully, I think it's definitely been a change, but it's been one that's been really interesting. It's been an opportunity to really listen to some of the feedback that we had gotten about creation of an app. Prior to COVID, we had had this kind of youth advisory board, and they had suggested how important this was to them. But after COVID, we recognized how immediate that change needed to be. So we created that app actually right after COVID, but some of the prototypes were made before COVID. Additionally, one of our youth described how in the past, our program has been very single school focused. And after, with COVID and this virtual sort of facilitation or mode of interaction, we have this youth advisory board that now involves students from all different parts of Mumbai. So different communities, different caste, religion, different socioeconomic statuses, different cultural backgrounds, different communities altogether, look and feel of and vibrance of each different community is so different, and even linguistically. So it's been a chance for these youths to connect with one another. And we keep hearing it over and over and over again that's been a really exciting part that we would never have had the opportunity to do, in fact, if COVID had never hit. So that's definitely something that's unique and a new flavor of things. But ultimately, the heart of our program is for the youth to lead initiatives and the youth to really lead communication around health, and that's still happening. So I think that part has still stayed. And I will say for 75% of our youth, this is something we studied, 75% of them had never spoken in front of their classes before our program. So our hope is just to continue to give them opportunities to speak and engage and to build that confidence over time.
And for the last question, was there something unique about the situation in India, or do you think peer education programs like these are untapped potential, are potentially appropriate in other parts of the world? I mean, how might you like to see the lessons learned in this type of program spread?
Oh, absolutely. I think one of the reasons to have a really evidence-based approach and to really study our progress through the lens of implementation science and community-based participatory research is because we hope it can be a model that can be replicated. That being said, there are many contextual factors that are very specific to India that you can't really sort of replicate in every single place. But I do think there are core features, some features that definitely could be utilized in other parts of the world. For our curriculum itself, there are many components of it that include the biological aspect of change and emotional, mental health, physical changes during adolescence, but also includes many of the cultural stigmas and taboos and very culturally relevant components that I don't think could be transplanted to other parts of the world. But as a whole, peer education, our goal is really to study this impact over time, even through a controlled trial, to see how does this work? Can youth themselves, where there's so many youth and so many youth with such promise, can they be part of this change? And that's ultimately the goal of the work, is to over time build to the literature, build to the scholarship, and really have youth actually writing some of those articles too as first authors. That's the goal in the coming months and coming years, for our youth to really be talking about their work, to be writing about it, to publish, to share how this can actually be something that could be disseminated in different ways.
Well, thank you so much, Priya. Thank you for sharing your story and spending your time with me. This was fantastic. Thank you.
Thank you so much. I really appreciated the opportunity to speak with you all, and I'm looking forward to hearing from some of the alumni as well.